Okay, if I could have your attention, please. We're so glad to see such a good turnout today. Thank y'all for coming. And I bet you've guessed what our speaker does, haven't you?
Yeah.
So you're in for a great presentation tonight. I'm not going to ruin Terry's presentation by telling you too much about her because I want you to hear that from her. But if I remember right from reading a little bit about you, you've been doing this since what, about 1996? Was that right? And you've been a nurse since 1974? So she has lots of experience. So I am excited to be the beneficiary of some of that experience and knowledge tonight, and we're excited to have her here and providing services here locally for us. I know y'all are busy eating, but I don't want to forget to give you this. You have information in front of you on a sheet of paper with some of the numbers where you can reach her in, I believe, Colonial Heights and stuff. But I want to give you a local number where you can actually call and make an appointment with her if you'd like to. So I'll give you a minute to wipe your fingers and get your pen. And you're going to find Terry over at Southern Virginia Medical Group. That's the office over where Dr. Thien, Dr. Zoll, Dr. Chikina, all of those are. And the phone number over there is 348 4680. Okay, so without further ado, I'll turn it over to Terry. We're looking forward to this, Terry.
Thank you. Thank you. Well, first, I just want to let me know if I don't speak loud enough. I have a tendency to speak very softly. So I want to thank you so much for letting me come to talk with you about something that's so close to my heart and really so much a part of me. Midwifery is not just what I do. It's really such a big part of who I am. So I am so looking forward to sharing this with you this evening. Back in 1994, I was still the director of education at the hospital in South Hill, Community Memorial Health Center. And Steve Kelly was the CEO at that time. And I was back in school, and I was talking to him, and he says, "Do you have to be called a midwife? You know, so what is midwife? You think torn sheets, boiling water, and newspapers, and home births." And honestly, I say that, but still a lot of people think that. They think home births, and not really too much beyond that. So I thought, okay, I need to help him understand something. And what I want to show you is right here. It says midwife comes from the old English term midwife. Mid, with, weave, woman. So no, I would never want to be called something different. Because as a midwife, it means that I work with woman, whether she's in labor or more. We're going to talk about a little bit more about what midwives do now in today's society. All right, here we are. Look at this picture. It's lush. It's beautiful, mysterious, incredibly intricate, and very special. Just as we are as women. Now, here we have all these wonderful men in the room as well. So as I talk tonight, I'm going to ask you, please, to think about the women in your lives, whether it's your mother, your wife, your sister, your aunts, your daughters, the women in your life. Certified nurse midwives are actually a combination of two professions. One as old as time, going back to Genesis in the Bible, which is midwifery, and nursing. All share a deep commitment to bettering maternal and child health, not only in the United States, but throughout the world. I'm not sure if you all have heard about it, but there's a big group out of Richmond called Midwives for Haiti. And Nadine Brunk, who is a certified nurse midwife, leads that, along with Virginia Physicians for Women. And they go frequently to Haiti. And they're not going down to take care of these women. They're going down to train the women there to take care of the women, to reduce the mortality rate for the mothers in labor as well as for their newborn infants. We are highly skilled health professionals who draw on the vast resources of modern science and the belief that often non-intervention is the best intervention. Sometimes, as you all know, doing less is better than doing too much. I have a wristband that I give the ladies that I see in the office, my pregnant women, and I don't know if you can see it from there, but on the outside it says Trust Birth. But just as importantly, on the inside where you can't see it because it's actually written in, it's actually, inscribed into it, it says women are strong. And I can tell you I see that over and over again every day. Just a little bit about the history of nurse midwifery. Our profession was established in the early 1920s, and it was because we had basically 10% of our babies were dying. 124 out of 1,000 babies were dying. Now you notice I don't have the maternal mortality statistics up here, but our moms were dying as well. The Children's Bureau came up with a plan that included public health nurses, basically for prenatal instruction, trying to teach women how to better take care of themselves. At the same time, the Maternity Center Association, which is now called Childbirth Connection in New York City, made up of a combination of obstetricians, nurses, and mothers, looked around the world at other countries where their mortality and morbidity rates were so much better. And the one thing that they saw that was different from the United States was that they had midwives. So if you look at Great Britain, if you look at Holland, the European countries where their rates are so low, and unfortunately in the United States ours is still very high in comparison, they have midwives and they go into the homes. They do a lot of home births. They do a hospital births. They do birth center births. So as a result, the Frontier Nursing Service was founded in eastern Kentucky, and if you get into your history and like history, that's where you see the midwife on horseback literally going out into the mountains to help these women have their babies. Let's see, did I go too far? Yeah. Now, it's been about 100 years, and now we have over 8,000 nurse midwives in the United States. We practice all over the United States and catch about 10% of all the babies born here. Now, I want to stop right there because you see the term catch. That's a philosophical difference between what I do and what OBGYNs do. I know better. I have delivered 2 children in my life. I have 2 sons. One's going to be 35 next year, and the other one just turned 30 this year. We deliver our own babies. The only thing that I'm there to do is literally to attend births or to catch that baby when I'm with a woman in the hospital. And I do hospital births, and I've done birth center births. I've never done a home delivery. So I guess the difference is that women and their families get the credit for delivering that baby. All I'm there to do is basically guide it out. It's rarely that there's a problem. Now, 2 reports by the Institute of Medicine and the National Commission to Prevent Infant Mortality praise the contributions of the nurse midwife in reducing the incidence of low birth weight infants and call for their increased utilization. One of the things that we're really active in right now is group prenatal care, and it's called centering pregnancy. It is done so well that they're now extending it out to centering pediatrics. And it's group care where everybody sits in a circle. You do your prenatal care and you learn at the same time. There's nobody so there's no hierarchy. It's not doctor this and, nurse midwife that. We're all on a first name basis. We learn from each other. It is making a difference in reducing preterm deliveries and also reducing postpartum depression. Over time, through natural progression, nurse midwives have increased their scope of practice. So not only do we catch babies, but we've extended well into the gynecologic realm and into the needs of women, which include annual exams, pap smears, contraceptive management, preconception counseling, and management during menopause and beyond, and prescriptive authority. I have a soapbox right here, and I'm going to share it with you just for a minute. You see this preconception counseling? For those of you with daughters or grandchildren that are thinking about getting pregnant, this is the holiday season, and what I see all the time is that we spend more time getting ready for our guests to come visit us at Thanksgiving and Christmas than we do getting our bodies ready when we invite a guest into our body for 9 months. And it's so incredibly important. With the knowledge we have today of how to prevent the water on the brain babies, you remember how they used to be fairly common. Thank God they're not so much anymore because of folic acid. The spinal defects, the spina bifida. So prenatal vitamins are incredibly important 2 to 3 months before somebody even conceives, because by the time they conceived, the damage could have been done. So anyway, I'll stop right there, but folic acid. All right, our practice includes independent client management and collaborative management, where we consult and refer to OBGYNs and other healthcare providers. I thought you might be interested in some of the things that I see at the office. A lot of what I do, I don't need the physician, but there are times when I really do. For instance, I had somebody who come in just recently, and she was only 27. She'd had her children, she got her tubes tied. Well, guess what? Then she started having all this irregular, heavy bleeding. So there's a new practice that's come about called endometrial ablation, where you go in and you use heat in one form or the other to thin out the lining of the uterus so that bleeding decreases. All right, now we're out a year later, and she's in a lot of pain, and the bleeding has come back. So what I was able to do was to evaluate her, check levels of different hormones, like her thyroid. Maybe it was her thyroid that was messed up. Maybe it was her prolactin or her pituitary was screwed up. So I was able to begin to look at all of those things, as well as looking for infections, making sure that wasn't causing it, doing an ultrasound. Once I got to that point, then I said to her, okay, I want you to see one of our surgeons, our OBGYNs, because she really was ready for a hysterectomy. She was sick and tired. So she has been scheduled for that hysterectomy, and she is a happy camper. So I guess what I'm trying to tell you is you don't want a knife in my hand. I don't do surgery, but I can get you to that point if that's what's needed. Also know that you always want to see somebody who is talking to you about your options and not trying to push you in any certain direction. You don't want anybody to tell you what to do. You want somebody to talk with you about what to do. This sort of talks a little bit more just specifically about what midwifery means, and it's midwife means with woman, but it's for a lifetime. So basically I work with women from their first menstrual period all the way through the postmenopausal years, doing comprehensive gynecologic care, well woman health visits, health maintenance education, cancer screening and mammography, your immunizations, the human papillomavirus and influenza, sexually transmitted infection screening and counseling, heart disease and osteoporosis risk, menopause management, and abnormal pap smear management, including colposcopy. So if somebody's had an abnormal pap smear, I actually do the colpo and send the samples off to be read. Now, just a little bit about me. I've been, as Tracy told you, a registered nurse since 1974. And I graduated from the Bachelor of Science in Nursing program at the University of Virginia. I attended Emory University in Atlanta in the Clinical Nurse Specialist program in pediatrics between 1976 and 77. I was able to teach pediatrics in 2 associate degree nursing programs for a total of 8 years. One was on the coast of North Carolina in New Bern, and the other one in Raleigh. I worked in pediatrics, pediatric intensive care, neonatal intensive care, newborn nursery, labor and delivery, postpartum, med-surg, chemical dependency, and then the last for 5 years as the director of education hospital-wide at Community Memorial Health Center. And that was before and during the time I was in graduate school. Between 1994 and 96 is when I was at East Carolina University in Greenville, North Carolina, and that was a combined Master of Science in Nursing and Midwifery program. So I'm actually nationally certified by the American College of OBGYN. So just as physicians need to be certified, so do nurse midwives. And here I am. I'm back in my home community, or very close to it. I live near Alberta. Introducing centering pregnancy, group prenatal care, offering massage and aromatherapy during labor, as well as I use a lot of imagery, some pressure point therapy, and water labor. Not water births, but water labor. It's incredible. You hear about epidurals, right? We call the pool aquadurals. So, my goal, when a woman relives her birth experience, and whether it be the very next day or 20 years later, I want her to think of it as one of the best experiences that she ever went through. If you've ever been with a woman who had a negative experience, they sometimes are actually experiencing post-traumatic stress disorder. I've seen it several times where the whole pregnancy, she couldn't enjoy it because she was so scared of what she had to face at the end. And also the other goal is to care for a woman through her entire lifetime, from the beginning to the very end, and to work for her to help her achieve her best level of wellness. All right, beautiful, serene. This is actually sunrise over Nassau, so it's a new beginning of a new day. And remember, every day gives us the chance to once again take care of ourselves, love ourselves, so we as women will continue to do what we do best, which is to care for others. Over here on this table, I have several handouts, and I want you to take advantage of them. One is on Pap tests. So I have a question for you. When does a woman need her first Pap? How old? It changes all the time. So do you know the most recent guidelines? Age 21. That's the first Pap test. When does she need her last one? Age 21 is when you need your first one. Whether you're sexually active or not, age 21. When do you need your last one? Anybody want to guess?
65. The day before you die.
Certainly used to be that way. Yeah. Well, there's several answers to that. One is, have you had a hysterectomy or have you not? If you've had a hysterectomy, did you? There's a gentleman back there going, no, not me. If you had a hysterectomy, did they leave the cervix or did they take the cervix? If you had a hysterectomy, was it for cancer? So the answers to all of those things change the answer to how often you still need Pap smear. But actually, the lady that said at age 65, it's age 65 if you've had 3 Pap smears in a row that were normal and no abnormals in the previous 10 years. So that's right. Okay. Here's one on caregiver stress. I thought this might be interesting. You know, we're all here in an age where many of us are probably still taking care of our children who moved back in or who are just struggling in this economy, and then also maybe trying to take care of our family members. So this talks about caregiver stress and some things to do to try to help us get through that. Osteoporosis information, heart healthy eating, screening tests, different ages and different screening tests and when they're due. And I apologize, I misunderstood. I didn't realize that there were men here tonight, or I would have had one for you too. And this one is for women. And actually, all of these come off of womenshealth.gov, but the one for men is also there as well. So when you go down to screening tests, it gives you the choice. You can pick whichever one you want. Then information on how certified nurse midwives function in the state of Virginia. Menopause symptom tracker. You know, the average age of menopause in the United States is 51, but perimenopause starts way before that, 5 to 10 years before, where symptoms begin. And then we're supposed to be through this, you know, 5 years or so afterwards, but some of us in our 70s and further along are still dealing with this. So this is just a menopause tracker for symptoms. And I don't know how much you all have had a chance to read about what the Affordable Care Act is going to do to help women. That's actually one of the really good things in the upcoming health care reform. There are a lot of things for women in there that makes it easier for us. So I have that here for you. That's it. Oh, wait a minute. I have to promote our hospital and our wonderful baby unit. So if you've got somebody in your family who might be thinking about it, Milky, it's a beautiful unit. This is Southside Regional Hospital. I work for Tri-Cities OBGYN, and one of our offices is in Petersburg, near that hospital. The other one is in Colonial Heights, which is where I am most of the time. I'll be coming every other Friday to Emporia, and this Friday will be my second time. All right. Please have questions for me.
I was going to say, we're not letting you off that easy. Does anybody have a question?
And if I don't know, I'll tell you I don't know, and I'll find out.
But 50 years too late for me.